The first thing we always think of is the skin, which is our largest organ, and it's made up of about 1.5 to 2 meters squared of surface area. It's a dynamic regenerative organ, which is approximately 15% of our total body weight and contains 1/3 of our circulating blood volume at any given moment. The integumentary system also includes hair all over your body, your nails, protective glands like sebaceous or oil glands, sweat glands, mammary glands, and ceruminous glands, which are your earwax. It's important for maintaining homeostasis, which is the ability to regulate our body temperature and fluid balances. It provides protection to organs and tissues from external environment, acts as a barrier for germs and other invaders, promotes wound healing, especially with the help of the immune system, synthesizes vitamin D from the sun, and provides sensory information from the outside world to the brain and the nervous system. Skin changes in the elderly are related to intrinsic and extrinsic factors. Intrinsic factors incorporates the chronological aging and physiological factors like genetics and hormone alterations, while extrinsic factors include environmental exposure to UV radiation, pollutants, toxic chemicals, and lifestyle choices such as smoking. With normal aging, the epidermis or outermost layer of skin becomes thinner, although the number of cell layers typically remain unchanged. The population of melanocytes, which is the cells responsible for pigmentation production, gradually decreases. However, remaining melanocytes often enlarge, contributing to uneven pigmentation. Hyperpigmentation lesions, such as senile legendines, which is also called age spots or liver spots, might develop, particularly in exposed areas to the sun. Structural changes such as thinning, flattening, atrophy, and contraction of the dermis occur due to a reduction in collagen and elastin fibers. Decreased in adipose or fat tissue in the skin leads to wrinkling and a loss of elasticity, but it also diminishes the skin's insulating capacity and protective cushioning. This change increases susceptibility to temperature dysregulation, including hypothermia in cold environments. It also heightens the risk of pressure injuries or trauma. Some medications are actually absorbed through our subcutaneous fat, and a reduction of that layer may alter drugs' pharmacokinetics. The blood vessels in the dermis become more fragile, increase the risk of bruising and spontaneous bleeding. It's often called senile purpura. In addition, benign vascular growths such as cherry angiomas may develop. Our sebaceous glands decrease as well, impairing the body's ability to cool itself. And as a result, older adults are more vulnerable to overheating and heat-related illnesses such as heat exhaustion and heat stroke. With the skin becoming more transparent and thin, it actually increases the risk of wounds such as skin tears, and they usually have healing impairments. Benign skin lesions such as skin tags, nevus, and vascular lesions like actinic keratosis, which is rough pink patches caused by sun exposure, carry a huge risk for the progression into skin cancer. Head, facial, body hair in the males decrease and increases in females in response to altered hormones. The pubic and auxiliary hairs thin, straighten, gray, and lessen in amount. We can actually see alopecia more evident in males and females. Nails lose their luster and toenails thicken, particularly if arterial insufficiency is present. The assessment and diagnosis is very dependent on which type of the integumentary system there's a concern for. The most important aspect is if something seems off, get it checked out by a doctor. So let's focus on skin assessment for skin cancer, checking moles, birthmarks, and other parts of the body for A, B, C, D, and E. A is for asymmetry. One half of the growth looks different than the other half. B is for borders that are irregular. C is for color changes or it's more than one color. D is for the diameter. It's greater than the size of a pencil eraser. And E is for evolving, meaning the growth changes shape, size, symptoms. It might have bleeding, or it might have excessive itching or tenderness. Assessment really does involve a doctor, so they identify symptoms like rashes, unusual moles, lesions, or hair loss, followed by different diagnostic tests depending on what the problem is. When atypical presentations lead to skin concerns, removal of the problem is the most important treatment, followed by, depending on the aggressiveness or if it is forms of cancer, can also include chemotherapy or radiation. Imagine if we don't need treatment because we prevented atypical growth. So, prevention tips: stop smoking, get checked out by your physician regularly, especially if you find a concern, and don't forget the sunscreen. The higher the SPF, the better. Typical skin aging doesn't have to be a problem anymore.